Let's shift the conversation and now talk about vaccines. So we have vaccines that have been donated to us left, right, and center.
So we are told.
We have been told by Aden, we've been reminded by Aden Duale that Parliament approved 35 billion shillings to be used to purchase vaccines for Kenyans. We were told by Dr. Hwale that there's some 10 billion shillings that has been spent now here and there to purchase some vaccines. Where are these vaccines? Are they coming? Dr. Andrew Mulwa joins us in the studio. Dr. Mulwa, the last time was here, was working for the county government. Now, Dr. Mulwa is working for the national government. Hey, Dr. Mulwa.
Let's greet you. Good morning again. Good morning.
Good morning.
Time.
Good morning, the new doctor.
Thank you. Thank you very much. And thank you for inviting me to the show. I am now working in the Ministry of Health as the Director of Medical Services, Preventive and Promotive Health. And yes, we have vaccines in the country. I think this morning we have about between 400 and 450,000 vaccines in the country, which have been distributed or deployed in about 800 stations in the country, and vaccination is ongoing in these stations. However, it is important to raise that we have a major global challenge in vaccine supply chain, and there is what we are calling nationalization of vaccines, that the richer countries have purchased all the vaccines, have paid the manufacturers in advance to manufacture for vaccination of their people. So through the United Nations mechanism, the WHO COVAX mechanism, we are able to get some of the vaccines that are flowing in this country. They are not flowing at the rate that we would want in terms of the numbers that are coming in, but we have some vaccines in the country. And from the month of June, the supply has been fairly steady, I would say. We have been receiving vaccines through the COVAX mechanism that we have not run out of supply like we had in the month of May and thereabout. So currently we have some vaccines that are on way. I said we have been doing AstraZeneca. We have received about 2.7 million doses of AstraZeneca. Some have actually been direct donations. You are aware that UK donated 880 doses. Spain, Greek, many countries have come in to donate vaccines to the country outside the COVAX mechanism. Through the COVAX mechanism, we received close to 2 million doses through the COVAX mechanism, which is now the global mechanism. We also have expect to receive Pfizer next month. Of course, would have come earlier, but we need super ultra cold chain, which is negative 70 degrees Celsius, which because the vaccines that we have been using routinely as a country, we have never had a vaccine that requires that capacity. So we have to build that capacity for storage. Then we also have Moderna that is coming, about 1.8 million doses that are coming in the next 1 week or so. We have the government has purchased Johnson & Johnson 13 million doses, of which we expect the first batch early September. And therefore, our thinking as a government is by the end of December, we should be able to have vaccinated close to 10 million Kenyans. The target is by June 2022, we vaccinate at least 20 to 26 million Kenyans.
You know, this Pfizer, Moderna, and Johnson that we've been expecting.
Did I mention Sinopharm? We also expect a donation
from China.
From the COVAX mechanism. We expect close to 2 million Sinopharm.
Expect?
Yes, which should be coming. It's already on the pipeline. It's just shipping. It's a UN system, so they notify us that these vaccines are coming. So that we have already been notified.
And they give you a timeline as well?
Yes, of course. When I speak, I'm talking about 1 week, maximum 2 weeks. They should be here.
You know, when Dr. Hwale, who's in charge of the vaccine rollout, was here.
He's the chair of the task force on vaccines.
3 weeks ago, he was telling us within the next 1 week or 2 weeks, we should have these ones. the Moderna and the Johnson and the Pfizer. Now, the Director of Medical Services is here telling us in the next 2 weeks, they shall be here. And we keep asking, so why is this goalpost shifting? Why are these deadlines not cast in stone?
I think I mentioned is a global issue. In fact, if it were in the power of the Kenyan government, we would have had Johnson in July, because we made payments in June, and we expected. But I talked about vaccine nationalization. Richer countries are buying the vaccines at a higher price than we are buying, and they have more influence in the pharmaceutical industry than we do, and therefore the prioritization sometimes we are moved down in the priority list when, like, for example, a country like US wants J&J, they will be given a priority, because what we are paying per vial is probably 10 times less what they're paying, because that's the reality of the market dynamics. Because for us, we have to, developing countries, we have to get price subsidizations here and there. So that is one reality that we are facing. We also have the issue of back handling of these vaccines. So while, like, we say we want to have the vaccines, remember these have to go through the cold chain. We have to ensure that the couriers, the DHLs of this world, have to schedule so that these vaccines come here. We don't just have vaccines that have arrived in the country and we have the numbers that we want and the vaccines are not viable. They have to be done in such a way that the potency of the vaccine is maintained throughout the chain. So those are some of the things that are causing delay. And when we talk about this, there are official communications to this effect, and we keep on a daily basis following up to check the status of these vaccines.
Dr. Mulwa, would it be harmful from your perspective as the Director of Medical Services to actually state and say that we have been promised thus, but we are really not sure? Because the not sure bit never really comes in.
I think I choose to be an optimist, rather to be a realist. The reality is every systems fail, expectations fail, official commitments fail, but I choose to be optimistic, because the donations that we have been expecting, they have been flowing in the last 2-3 weeks in a fairly reasonable manner. So I would personally say we have commitments. We are engaging our bilateral partners. We are engaging the multilateral partners in COVAX, and we take their commitment. Sometimes it's not possible to meet the commitment, but we take the commitment. And we have a duty to communicate or to share the information that we have to the Kenyan citizens, so that they also are in tandem with what the government is planning, or what the government is doing as far as the issue of vaccination is concerned.
You know, if I were to contextualize this, I would have to agree with you completely, but it brings about a conversation we keep having here, and it's one of communication. You see, the efforts that you make, they have to be there, otherwise we wouldn't have had any vaccines in the country at all. However, within the context of wanting to give the country hope, see, when hope is dashed, it's worse than if it was not given in the first place. It may appear that being realistic may necessarily not be the best thing to do, but in my mind it is. Because if people are told, for instance, that there is a delay and there is an accompanying statement that we are not certain about the delay, but we will let you know as soon as we are certain. In my mind, it is far better than if you say it's a delay and in a week's time, in 2 weeks' time, in 3 weeks' time, because we count the weeks. And when the weeks lapse, we're saying, okay, now. And this has
how
nothing...
do we trust these people?
Yes, and it has nothing to do with what you're doing and the efficiency and the hard work that you're putting in. It has nothing to do with that. Some of it you have inherited because it's the ministry. So it has nothing to do with the office and you. But because of the history of broken promises, now we even go back to the government. People will, it's government. We're back to square one again, are we?
I think to be fair on this matter,
Yes.
the government has done really well in terms of sharing the information that we have.
What
That's
specific
number one.
information?
Number two, we have had challenges. I was in the counties when we started this exercise of COVID-19 vaccinations.
Yes.
And we actually had, in the beginning, we had we actually had hoped that second doses would be given at 8 weeks. And the government, through the COVAX mechanism, all the demand, global demand, 8 weeks lapse and there are no vaccines in the country. We came back and told the country, look, we anticipated to have these vaccines at this time. We have not received them. But scientific data shows that vaccines given between 8 and 12 weeks are effective. So second dose comes at 12 weeks and not 8 weeks. Isn't that communication? Sometimes when failure occurs, we also communicate. When we get the promise, we should communicate. So we should communicate at all times. When promises are failing, when we communicate, we share the information with the public so that I don't have information that I need to share with the public that the public does not have. Sometimes you will count the weeks, but I will also be coming and telling you, I also anticipated to have these vaccines this week and they have not come. And I think that's the bottom line. And that is the essence of us continuously. Dr. Akwale and the ministry team has been, on an almost daily basis, been sharing the vaccine situation in the country.
That's
and I
very
think,
true.
Yeah.
That's very true.
Yeah.
You know, at the when the 2 weeks lapse
Gods will be shifted.
and you haven't received, you will come back and say that.
Yes.
But that's where the communication challenge comes in. Because when you say in the next 2 weeks, you make it sound definitive.
It is definitive
That you're
because
receiving
we
them
have
in the next-
communication to that effect.
But that's where that's
That's the
out
crux
of
the matter.
experience,
You know that there could
You
be a
know.
delay.
right? And I think that's where the importance of the communication of how you message should come in and say, we anticipate to have them within the next 2 weeks. However, knowing because of challenge A, B, C, D, we are giving ourselves best case scenario, 2 weeks. Worst case scenario, 4 weeks.
Can I ask a
So we
question?
work
Can
with
I
the
ask
4
a
weeks.
question?
Yes.
Please do.
What would be the value of doing that communication when we already have vaccines in the country and we are not at risk of running out of vaccines and we tell the Kenyans that we have run out of vaccines? What we are actually asking people
The
is
value-
the eligible population, go get vaccinated. We don't anticipate any minute in the foreseeable future that there will be shortage of vaccines.
There was no anticipation a couple of weeks ago. I did not receive my second jab after 8 weeks.
That was in the
See?
beginning
Yes.
of the process.
So the value
So
would have
we-
been to manage my expectations as well.
which we did.
That's what I'm saying. So at the very beginning, the value of saying it's between this time and that time, and should they not come, you'll still be fine. At the very beginning is important.
And I think that has been
Because
the
when-
government communication.
That's not the case. The case was, we're expecting first of all, the first time that our cabinet secretary said we're expecting vaccines, we were expecting them end of December, then January, then end of January, then February, then end of February, and then they arrived. And then the second jab was to come within 8 weeks, then 12 weeks. Then there are some people who did not receive. Then now they have come. Are you seeing what is happening there is that you're creating that doubt in somebody's mind. It's like somebody's telling you, I know I owe you some money. I'm expecting some money to come from somewhere.
I'm not sure when it will come.
By end of day today, you'll have your money. When end of day today comes and you have not received your money, you start doubting me. And there's nothing as bad as you doubting me, because next time you will not lend me that money. True?
On that aspect of money, I will agree. But on the aspect of vaccines, I think I am convinced that the government has put in elaborate mechanisms to ensure that this communication first goes out. Maybe we could have done not as good through the media, but the structures that have been established by the government. We have weekly task force meeting where counties, and remember this communication sometimes is not necessarily from us who are in the National Ministry of Health, and not from the Cabinet Secretary, from the PS, the DG, or Dr. Kwale. This communication is the service providers. The person at the vaccination center in Makueni, in Kibwezi, in Sultan Hamud, in Nyeri, in Turkana, is the one who actually communicates best. Because we may be talking about vaccines in the national mechanism, and in Lodwar, we have 1,000 doses, and they're about to get finished. So it is also important to realize that this communication is multi-layered. We have civil society organizations, AMREF, Red Cross, who are also working in this space. They also are doing some communication. So I think, and maybe I want to believe, you are judging us from the media communication. But in terms of real-time communication in the communities, there is a lot that is happening in the counties. There is a lot that is happening in the vaccinating facilities. If you go to Nairobi Hospital, they give bulletins on how, when they have vaccines, when they are low vaccines, you go through their mechanism, they have. You go to Aga Khan, the same thing. You go to, and we continuously continue to publish these facilities where most of the communication actually
I'm actually
happens.
waiting for you to mention a government hospital.
I mentioned Makueni and I mentioned Lodwar.
No, I'm talking about the big ones where there are many people like Bagathi, like...
Bagathi and Kenyatta.
Loitoktok
and
Level 4 Hospital
Nairobi
is offering vaccines.
Yes.
The people in Loitoktok do not know that
there are
these
vaccines available.
vaccines are available.
Level 4.
The general population. It's
We are doing
a certain
communication.
group of people who then are close to information that will know.
We are sharing this information with local media outlets. We are sharing this information through the national government administration structures. We are sharing this information.
See, I'm
through-
telling you, it's not happening.
Then where it is not happening, then that is feedback. And what if the value of feedback is to enable us to pull up our socks and improve so that this information reaches everyone.
Let me give
we
you
have a challenge.
Let's
I must
let's
say.
do a case study, okay? Having worked as a CEC in Makueni for long, you therefore must know how many doses, for example, have been sent to health facilities in Makueni. On
Yes.
average, how many?
Yes. So far, maybe about 22,000 or thereabouts.
What is the rate of uptake of this?
I think the last time that they picked was 5,000, which I expect to be over today, and they are receiving others today.
If we went to Makueni, every corner of Makueni, from Emali to Ote to Kibwezi, do you think people know, yes, there are vaccines in this place, I'm eligible, I'm going?
Yes, I would say 100% yes, because one, the county has its own social mobilization structures. We have community radios. They have used those structures, and many counties. Sometimes I say I choose to be optimistic that we may have one area or two that have failure. We actually have an obvious equity issue in terms of vaccine uptake, where in Nairobi the uptake is high, areas around Nairobi, but when you go to northern frontier counties, Mandera, Wajir, Marsabit, the uptake is low. It's
Why?
concerning us as a government.
Why is it low?
Because one, there is communication, there is cultural barrier, there is physical access issues, and as a task force or as a Ministry of Health, we are aware because we are to get the data, to start getting the data, to internalize the data, and just realizing that even as we talk about vaccinating Kenyans, there are areas of this country that are getting vaccine marginalization. So we are now laying strategies to enable us reach these populations in a way that they are able to catch up with the rest of the country.
How? I'd really like to know what the strategies are.
One is outreaches. That the nearest facility in Marsabit could easily be 200 kilometers away from where I live.
Yep.
So I need to ensure that I don't use the Marsabit Referral Hospital or Moyale. I need to use to get other facilities that are closer. So we say for these communities that we can take the vaccine to the health center level. We can take the vaccine to the dispensary level. While in Nairobi, we may not necessarily have to move to the dispensary level. The vaccines are good at the level 4 facilities. and over. So this is a conversation that we usually have. We are reviewing this process every week. I am personally reviewing this thing every single day and getting to understand where we are.
One would expect,
and
Dr.
the commitment
Mulwa,
that we can give Kenyans is, for the time being, we are not at risk of vaccine stockout.
personal responsibility as well, Dr. Andrew Mulwa, as we're talking about vaccine and people knowing the importance of the vaccine, the importance of going for the vaccine, the importance of getting the jab. You've said there are some areas of this country where you're seeing low uptake of vaccines. So vaccines have been sent a certain number, but it takes a while for some counties to register high numbers. Even before we go to those northeastern far-flung countries where distance between homestead and hospital is huge, counties like Vihiga, even in the first round, we were still seeing the same. Not Vihiga, but Nyamira. What was the cause of this?
I think, truth be said, that there are a lot of misinformations about vaccines, even amongst very learned people. That one, this is a way of controlling population. When you get the vaccine, you start attracting magnets. I don't know where magnets, after you attract them, where you take you become magnetic and start attracting objects. You lose your fertility. All sorts of things. Even some religious groupings start feeling this is a spiritual fight and all that. And so once you have the vaccine, you are being prepared for the Antichrist. All those things are going through communities. There is usually, even under the routine immunizations that we do, there is a huge anti-vaccination campaign globally. So when you think about this vaccine, and probably other than the flu, the influenza vaccine, which mostly in Western world, they take a jab every year. This is like the first time that in this part of the world that adult population is being asked to take a vaccine. We have had issues with tetanus toxoid, and you have heard the religious groupings, some professionals say all sorts of things about them. We have
some who are even members of your profession.
Of course, yes. Of course, yes. Because there is a difference between science and personal belief. So this was expected. So there is hesitancy to take these vaccines for various reasons, and those misinformations and it's very painful. Last week on Monday, I buried one of my close friends, who was one of the agents of anti-vaccines. He got COVID and succumbed. May his soul rest in peace. But the reality is, even as we continue to pass this message, there are some people, there are communities that are too far from accepting this vaccine as a routine thing.
So there's need then for
continuous community health education.
Okay. From the ministry position, is there a general understanding or even a consideration that one of the ways in which we can open up the economy and stop this business of curfews and such like, and get people to go back to gainful employment or even running their businesses, is to vaccinate the entire population? If there's that understanding, then really is there a fight tooth and nail to make sure that in the shortest time possible, the majority of the population can be vaccinated from an economic point of view?
Truth be told, if it were in the power of the government of Kenya, we would have done these vaccinations to 60% by now. But we also realize that our state of economy, in terms of the position of the economy globally, is not as strong. So we cannot have the vaccines that we want when we want them, because of the issues that I discussed earlier. So the reality is, why we are pushing for this vaccination, why we are we are anticipating to have vaccinated 26 million Kenyans by the end of next year, is because at that point we will be able to say we have reached herd immunity and therefore life can open up. You've seen what is happening in Europe. You've seen what is happening in the Western world. They are literally opening their economies as if there was no COVID. They are already thinking about a third booster dose for some of the vaccines. And my honest opinion is I fear that may disrupt the developing countries' efforts to access vaccines. Because why we are having stable access of vaccines in the current period is because they have already reached their demand. And therefore, their demand is not as high. If they create another avenue for demand, I can tell you, we still go to the same global crisis. And we are talking about developing countries. Asia has countries that have this problem. The whole of Africa has this problem. Southern America has this problem. So it is not just an issue of Kenya, it's an issue of global economics. So I think while we are pushing this, and if like for example J&J were to tell us we are bringing the 13 million doses between now and December, I can assure you we have done it before. We have done immunization campaigns for measles, and in 2 weeks vaccinated 5, 6, 7 million people. We can do it. It has been done
the other day, right?
Yes. And polio is not injectable, so I want to use measles, which is injectable.
It's a Shindano.
The Shindano is different from oral. But we have done it before. We have done immunization campaigns before. We know how to do it. It is now our limit is on the supply chain. If we add 10 million vaccines today and are to be deployed within a month, we can. We have done it. The ministry has done it.
Yes, that's what I'm saying. It's been done. And I think even
so for us, it is not how. For us, we have to balance between the supply chain.
Even the polio aspect of it, whether it's injectable or not, the mechanics of it, whereby you had people walking 2 by 2, going to everybody's home in the country and getting this done. It's possible to be done.
We can do it.
So we're saying the one barrier to this is the supply.
Because today...
There's the other barrier, Dr. Mulwa. And this is on the implementation of running this thing. So the first 4 weeks, we were told that these vaccines are only available. The task force decided, we need to test the system as we roll out. And that's why you had just a few health facilities having the vaccine.
Do you know why?
And then you expanded that and said, all right, now we have seen it, so let's expand and add these other 600 or so health centers around the country. Were these 600?
Yes.
Around the country. Today, as we speak, Nairobi, that has a population of 4 million, all right, has always been the hotspot for COVID-19. There are people who are wondering, so where do I get the vaccine? Every waking day, people wake up asking themselves, where do I get the vaccine? Yet people know there's a health facility near me. Why aren't you rolling it out to all the health facilities? Why does the NMS have to come out and say, so this is where we are going to roll them out?
Do you know why?
No, I don't.
For the simple reason that I've mentioned. You have 1 million vaccines. Like right now, I said we have 450,000 vaccines for the whole country today. So even if we wanted, we cannot have all facility have the vaccines today. But when we have now the stable supply, then we can say, yes, we have, like when J&J comes, we will deploy to the dispensary. We have no reason. The dispensaries do vaccination for other childhood illnesses. The same cold chain is required for J&J. So we will use them and offer that. But today, because of limited supply, we can only balance between the supply and demand. So you only deploy where? If you don't tell people go and you take to a dispensary and you only take 10 doses. So the doses, people come and the following day there's nothing. So you have to balance that. So it's a balancing act that we are doing, and we are improving in terms of the commodities within country. And I think when we get there, when we have enough vaccines, you will see even campaigns come outside your doorstep that will say in every community, in every village, we'll have people who are vaccinated.
For example, Joel, who writes in and says, there have been no vaccines at Malindi Hospital. I'm not sure which one he's specific, but if we're saying there have been no vaccines for the last 2 weeks, would this still be part of the balancing act?
No. Absence of vaccine in Malindi, if true, I will pick that up and confirm, is the logistics, county logistics now. We have the vaccines at the national level. We have a depot in Mombasa. We have a depot in Nairobi. And Malindi should be getting from Mombasa. And maybe something within themselves. Maybe they do not have a car to pick the vaccines. Maybe they have not reported back to the county management that there can only be an issue within the Kilifi County issue.
I actually support
management.
what you're saying completely, because I have been in situations where you are told they've run out of vaccines, and in reality, it's logistical. They are available, but somebody hasn't bothered to go and pick them up. Sincerely.
Yes.
And they tell you, we haven't got them. Yes, because somebody hasn't gone to pick them up. And they know they should go and pick them up in order to bring them.
That's Dr. Mulwa's officers on the ground.
No, Dr. Mulwa does his bit. It's not his bit to take it
I
to
am
every-
now at the national level. When I was in Makueni, I would be the one to
physically go and
ensure that Sultan has the vaccines. Now I'm at national level, is to ensure that the continuous supply of these commodities at the strategic stores. Once they get
And
to the
then the
strategic
co-
stores,
the
then
county.
communicate
And
to the
ev-
counties.
and
which
every
we do
county has
every
one.
week to ensure that counties are aware of the commodities that are available, where they can pick them, and we have also a tentative distribution schedule so that you know this is what you're supposed to get. And we also redistribute so that we don't have expiries within the facilities. Like where the uptake is low and is approaching, we also recall and redistribute to areas of high demand.
Yeah, we saw that there was a recall in some
Yes.
counties whereby they were not inoculating, and then thereafter they were asked back. Okay, so what happens, and what is the position today on private companies bringing in vaccines? Or are we still saying that any vaccines that will be administered to Kenyans now will only come via government?
I think we have read in media about issues in some countries that opened up private vaccines for the time being, and for the public health. These vaccines are public health good, and therefore will be government-led, will be a government-led process through and through. We don't expect to open it up for private sector, and for good reasons. One, we have a responsibility to account for the people who have been vaccinated. We have a global responsibility to report who has been vaccinated. So we have to be in control of the process and for the safety of the products that are given. Remember, none of the vaccines has been approved. What we have is emergency use authorization. So therefore, we have not gotten to a point that we can say open market,
Go.
buy
commercialize
and
it
sell.
yet.
Essentially,
We are
they're
not
still
there.
experimental.
So what is it that
Yes.
we are seeing with the Kenya Private Sector Alliance reaching out to its members and saying we are working to get the vaccines into the country? for your members?
We are working together, and they are part of the mechanisms that we have at national level for deployment of vaccines. We will work with them. We will give them the vaccines. We will use them as vaccinating centers. We are working closely with them.
Oh, so KEPSA is not going to import the
No,
vaccines.
we are working with them to ensure
They'll get the
Yes.
vaccines from
Yes.
government.
They are also going to. There's a plan that they also finance the COVAX mechanism so that we get more vaccines, and so that now for every person they vaccinate from their employees, they get 5 members of the surrounding community to also benefit. So we are working with them. The vaccines availing will be done through the government.
I think
system.
that's where the confusion comes in, because communication apparently from KEMSA is that you're an organization, we'd like to vaccinate your employees, and then you'll also support vaccination of others in the community. So pay X amount of money towards that cause. But vaccines are free. So it sounds like we are allowing KEPSA to import and sell vaccines.
We are not allowing them to import. What we ask them, we are mobilizing resources.
you're fundraising,
We are fundraising from the private sector, because the government does not have all the money. So we are fundraising from the private sector so that they help the government acquire the vaccines so that we can reach more people within a shorter time.
Before you came here, we had a member of parliament, and he has been in among the many committees he has been in, and one which he's currently in, is these committees that look into these affairs of budgets. And there's an amount he mentioned as having been allocated to the ministry. with
35
billion. Has that money all been spent?
That is what, when I talk about J&J, is what I'm talking about. We have bought 13 million. In fact, the quote price was for 10 million doses. But we, through the leadership of the Cabinet Secretary and His Excellency the President, we were able to negotiate for 3 million more doses of J&J.
So that cost us 35 billion Kenyan shillings.
Did I say 35 billion? It
No.
was never that much.
10 billion, according to what Dr. Akwale told us.
It was
So
never
where is
that much.
where is the other 25 going?
You see,
Where
you
is
see-
the,
you see, my
it has
question
never
is-
been that much.
No.
Yeah, state the question.
Let's get this thing straight. We were told that what was budgeted for COVID was
35 billion for vaccines.
for vaccines, not for anything else. Vaccines. So all we're asking is, sometimes we hear it has been budgeted. Sometimes what the Ministry of Finance has only released X amount of shillings. So that's what we're asking. Has that 35 billion been spent?
Been exhausted, so that you go now and start mobilizing funds from the private
Yes.
sector.
I think I would benefit from having the government printed estimates, because I am not just going to make political statement. I don't think there was ever that 5 billion shillings for vaccines. The Ministry of Health budget, the whole ministry's budget, is 121 billion. There is no way that 5 would go to vaccines. Only as far as I'm concerned, from the printed estimates that I have not seen that figure in our printed estimates. Maybe there could be some other money somewhere in space, which I don't know. But what I know is from the resources that had been availed to procure for vaccines, the procurement has already been done through the Africa CDC mechanism, which is what we've used to procure the Johnson & Johnson 13 million doses. The other is now the COVAX mechanism, which was not using that 5 billion.
Okay.
I do not have the figures with me, unfortunately, but it was never that
35.
much. It was never that much.
There's an issue here that may emerge. You know, when you talk about measles vaccination campaign, polio vaccination campaign, we just know it's a vaccine, all right? It's never been an issue of whatever brand it is. In fact, we don't even know. Now with COVID, there's a whole issue of brand A, brand B. Now you're talking about Johnson & Johnson, there's Moderna, there's Sinopharm, there's Pfizer, there's AstraZeneca. All those many vaccines. We have so far only had AstraZeneca. But soon we will have 4 other brands coming into the country. The issue of communication is very, very important, because people will start asking, so which one is more effective? Do I want Moderna? Do I want Johnson? Do I want Sinopharm? How do you intend to handle that?
First, all the vaccines that have been developed through a scientific process, and their efficacy has been approved, and all of them are WHO accredited. The only one vaccine that has an advantage over the others is the J&J, which is one shot, and just for the ease of administration, which means you just need to visit the facility once and you are fully vaccinated. We will, as we deploy the multiple vaccines, we will not be giving people Johnson & Johnson. We will not be giving people Moderna. We will not be giving people Sinopharm. We will be giving people COVID-19 vaccine. So if you walk to Nairobi Hospital for COVID-19 vaccine, you will get what will be deployed in Nairobi Hospital. Whether J&J, whether Moderna, whether AstraZeneca, whatever it is.
And you'll be
But
advised.
can I
And you will
choose?
be advised accordingly, because we will not give vaccine choice. That's the bottom line. Because
So if I come and I find it's Johnson, it's a
You will
single
take-
dose, that's what
that's what you'll
I'll
get.
I cannot ask, no, I want
I
two.
want something else.
No. We will be giving COVID-19 vaccine, just like you said about measles, and just like when you go to the hospital for an antibiotic,
You don't ask,
you
is
may
this Pfizer?
yes, you don't
For
ask,
example.
yes. So you will be given a COVID-19 vaccine, and we need to remain focused on the COVID-19 vaccines. There are many Kenyans who have been sending me messages and asking me, when is J&J coming? I want Pfizer. I want all these vaccines have been proven scientifically to have high efficacy against COVID-19, and all of them are safe, and all of them are good to go. In fact, I think, depending on when the clinical trials were done, some that have being given low efficacy are as a result of the epidemiological period in which the studies were done. Like a study is done when we are at the peak of a wave and you vaccinate 100 people and 10 get COVID-19. Doesn't mean that the vaccine is not effective. If you did when the curve is flattened and there are no new infections and you give 100 people, you don't expect them to get COVID anyway. So some of these things, and that's why I say all of them are good. All of them are good. In fact, closed trials have shown the ones like AstraZeneca, which was being given 60 something, when it is done in the same setup as the others which had been given in something, it actually has proven to be better. These are small trials that have been done, but the reality is the vaccines are effective, are safe.
I have a question, and this one has come also from some of our listeners. This is with regards to the Chanjo platform, the online portal where you go, you can register, you can download your certificate. Now, when I went for my COVID vaccine, I queued, and these people at the queue took my details, and then I got the jab. Now, there's information that's coming that people are being asked to go register yourself, and then you come for the jab. Does that contradict anything?
Not at all. Why? When you went there, the Chanjo platform was new, was being tested. We were not sure whether it could handle the numbers, and therefore, at the time, we could not tell people go self book yourself, so that when you just come and you come, give your phone and get injection and go. You had to go queue, you ask your ID number, your password, your spouse and what, and next of kin and all that. Then you are told queue now for the vaccine. You will have, it is efficiency. You will be avoiding that part of the queue. Of course, we understand in this country, there are many people who do not have access to internet-enabled gadgets or smartphones. So those ones, they will come and they will painfully have to queue for that queue. If you don't have that, you have already have booked yourself and you go to Bagadi and you have the message, you go straight to the vaccination queue and not the registration point. So this is a good platform for those who can access internet-enabled gadgets because it can be done over a laptop, can be done over a computer. It's good because it prepares you to go and just get the jab. You spend less time, there is no contradiction.
Asante sana, Dr. Mulwa. Come again soon when this end of August, 1.8 million Moderna should be here.
I actually thought maybe Monday, Tuesday, this next week, 2 weeks. In 2 weeks. Why I'm saying 2 weeks is just I am being generous with time. I'm looking at Monday. Tuesday. Actually, Sunday is when the shipping should arrive in the country. So Monday, Tuesday should be in the country.
Okay.
So by the time it gets to the facility,
Wednesday, Thursday.
Asante. City,
thank you very much.
30 seconds. Remind us the proverb.
A healthy person who keeps begging for food is an insult to a generous farmer.
Yeah. Healthy person who keeps begging for food is an insult to a generous farmer. Umesikia, Dr. Mulwa?
Yes. Thank you.
This is the Situation Room, the only way to start your day.